Hello, my name is Jennifer Nazarethian, and the purpose of this project is to implement an acute care nurse practitioner that can oversee discharges in order to decrease hospital readmissions. The goal of the project is to implement a transitional care model into hospitals using acute care nurse practitioners to reduce hospital readmissions and improve quality of patient transitions. The acute care nurse practitioner would be responsible for helping coordinate discharge for these patients, visit the patient at home, and also attend follow-up visits with the patient and their family. Transitional care is a growing area of healthcare. It is important to take into consideration the needs of the patient as they transfer between settings or are discharged home from the hospital. Why is this so important? Well, first of all, hospital readmissions are very costly. We will elaborate more on this soon. Next, improving the well-being of our patients is also important. According to Pellet, a well-planned discharge significantly improves the patient's health and well-being, reduces the likelihood of risk and harm, reduces inappropriate hospital readmission, and, in general, provides a positive patient experience. Transitional care interventions have been shown to decrease hospital readmissions, so why not implement them? The current nursing issue is poor discharge preparation and follow-up in patients with complex needs leads to hospital readmissions. Better transitions from hospital to home using the transitional care model can decrease hospital readmissions. In addition, the patient's health may be improved as well as their experiences with the healthcare systems. Some reasons patients may get readmitted could be related to poor discharge planning. Patients do not understand their disease or how to manage it, or patients may fail to attend follow-up appointments and may not take the prescriptions that they were prescribed. Okay, let's further discuss healthcare costs related to hospital readmissions. Preventable hospital readmissions are a major concern in the effort to lower the cost of healthcare. 13 to 20% of hospital readmissions could be prevented. Preventable readmissions end up costing Medicare $17 billion a year. 1 in 5 of all patients covered by Medicare are readmitted within 30 days. Implementing an acute care nurse practitioner to transition high-risk patients from the hospital to the home will help decrease healthcare costs and prevent patients from having to be readmitted to the hospital. So what can we do? We can implement the transitional care model. The transitional care model concentrates on the discharge planning coordinated by the acute care nurse practitioner. The transitional care model incorporates a discharge screening tool to assist in detecting patients that are at high risk for being readmitted. The table on the right of this slide is the Geriatric Transitional Care Program Risk Assessment Tool, which will help the acute care nurse practitioner determine what level risk the patient is for readmission. This tool takes into consideration certain medications, recent hospitalizations, home support, chronic diseases, recent falls, recent admission to skilled nursing facility or long-term care facility, and if the patient was in the hospital for greater than 4 days. The acute care nurse practitioner will begin by creating a relationship with the patient while still in the hospital, then continue to care for the patient at home. The acute care nurse practitioner is responsible for ensuring that the patient goes to their follow-up appointments, takes their prescribed medications, and understands their health issues and how to manage them. To further decrease hospital readmissions and improve quality of care, the acute care nurse practitioner may also accompany the patient and their family to follow-up visits. The acute care nurse practitioner will also encourage the family to provide care for the patient. The goal for this model is to ensure that the patient and the family understand the patient's health issues and how to manage them. The patient and family should be educated on how to identify potential problems early on in order to prevent a decline in health that may result in a readmission. Also, it is essential that the acute care nurse practitioner be available by phone 7 days a week. This project is applicable to nursing because nurses are on the forefront of discharging patients from the hospital. It is crucial to begin planning for a patient discharge at the start of admission and continue to plan throughout the patient's hospital stay. It is especially important for patients that may fall into the category of a complex discharge. Patients should be screened throughout their admission to determine if their discharge will be basic, moderate, or complex. More times than not, a patient becomes medically stable and all of a sudden it is a rush to discharge the patient. The pressure to discharge patients as soon as they are medically stable does not provide the patient or healthcare provider with enough time to organize and plan for the care the patient may need at home. But if the needs are assessed daily and the plans are made in advance, then when the patient is medically stable, it will not be such a rush. At times, patients are usually given a minimal warning and may feel anxious and overwhelmed by the thought of leaving the hospital and receiving a large packet of discharge instructions. If the nurses are constantly educating their patients throughout their stay, the patients may not be as overwhelmed. As an acute care nurse practitioner, one will be responsible for completing the discharge paperwork and writing the prescriptions. The reasoning behind assigning an acute care nurse practitioner to implement the transitional care model instead of a registered nurse is because the acute care nurse practitioner has advanced experience and the ability to diagnose and treat patients in the home. They could also prescribe new therapies and order imaging or testing without having to send the patient to the emergency department. The acute care nurse practitioner can adequately intervene in a timely manner to prevent hospital readmission or emergency department visits. A career trajectory is to care for trauma patients while in the hospital and to also coordinate their discharge. In order to properly discharge a patient, one needs to be aware of not only the patient's medical needs, but also their physical, cognitive, economic, and social needs. Does the patient have support at home, or will they be going home alone? Does the patient have a caregiver? If so, did we allow for time to properly teach the caregiver to care for the patient? As a future acute care nurse practitioner, certain aspects of the transitional care model will be implemented into my future practice. All of the knowledge obtained from researching care transitions will benefit my patients tremendously. A future qualitative study is to investigate primary reasons for hospital readmissions and to use the results to then prevent these readmissions by making adjustments to the transitional care model. The method of collecting data will be to have a researcher in the hospital setting to interview any patients who are readmitted within 30 days of discharge. The researcher will be able to then determine common themes for readmission. The researcher will also have the opportunity to ask the patients if they felt their readmission could have been prevented and what additional support would have been useful to prevent them from returning to the hospital. Once the primary reason for readmission is determined, the transitional care model can be modified. A future quantitative study is to apply the transitional care model to patients that are discharged to long-term care facilities and rehabilitation centers instead of just home. Any patient that is at high risk for readmission, whether being discharged to home or another facility would be enrolled into the transitional care model and assigned an acute care nurse practitioner. This study would discern whether there is a decrease in hospital readmission rates in patients who are transferred to rehab or long-term care using the transitional care model instead of not receiving any transitional support. The data for this study will be gathered through database searching. All the patients that are assigned an acute care nurse practitioner will be placed in a database and will be monitored for 6 months after leaving the hospital to assess patient outcomes and readmissions. The data gathered from this study will determine whether the transitional care model is beneficial in preventing hospital readmissions to patients that transition to rehab or long-term care facilities. Determining if it is cost-effective to implement the transitional care model for this patient population could be another area for future research. Alrighty, so we will do a little review of this presentation. So the purpose of this project was to improve transitions of complex patients from the hospital to their home by implementing the transitional care model. The measurable outcome for this project is hospital readmission rates. The transitional care model involves an acute care nurse practitioner facilitating the patient transition from the hospital to the home using multiple techniques to improve patient compliance. The acute care nurse practitioner expects that successful transitions from the hospital to home will improve health, improve quality of life, decrease readmissions, and decrease healthcare costs. This project has opened my eyes on the importance of discharge instructions, communication, and ensuring patients follow up in order to improve their health and reduce their chance for readmission. I hope you enjoyed my presentation. If you have any questions on this topic, feel free to reach out to me on the discussion board. Thank you for your time.